Hello, everybody. This is Steve Neidlinger, Executive Director of the Pennsylvania Academy of General Dentistry. We are very fortunate today to be joined by Dr. Stacey Gividen from Montana. She's going to be coming to our Master Track Peak 2 lecture in a few months, coming up in Bedford, Pennsylvania. Dr. Gividen, tell us a little bit. This isn't one of the three questions I want to ask, but I want to get a spoiler out there. What do we have to look forward to for our peak meeting in Bedford? And don't give too much away. Just give us a little hint.
Well, I am a down to earth type of person, so I'm hoping to deliver some information to people who not only have a need for some dental ergonomic applications in their practice. I want to also talk to the people who maybe want to be proactive and preventative, and then also people who just might be curious as to what ergonomics is and maybe how they can apply it. There will be some interactive components to it. There's going to be some giveaways of some pretty cool products. Some of them simple, some of them pretty cool if you don't have them in your practice already. So you're hopefully going to come away with a renowned effort and want to, change the way you do things, or maybe modify how you do things in your practice, because, we all know that we don't just go to work and that's the end of it. We have lives outside the walls of our practice. And I think that's really the drive home point that I want to send home.
All right, sounds great. I'm kind of looking forward to a little bit of activity on a Sunday morning at our peak meetings. So
yeah, I know. We'll see who wants to stick around.
Oh, everybody will want to stick around for this part. If it's okay with you, is it all right if we dive into our three questions?
Let's do it. Yeah.
All right. I should also say ahead of time, Dr. Gividen has an excellent knowledge of ergonomics. She has authored an article for us in the latest Keystone Explorer on ergonomics. I recommend everybody pick it up, read it, but we want to dive into a couple points in that article in these questions. So it's okay with you? Question number one.
Okay.
Most dentists are familiar with the basic principles of ergonomics and taking care of your body. Well, when it comes to putting it in practice, a lot of that knowledge goes by the wayside. Bad habits can be really hard to break, and good habits can be really hard to establish and maintain. Can you talk about being consistent and having a good ergonomic mindset?
First of all, I want to say I really appreciate this question, because I think this is something that is part of our day-to-day lives. We all know that we have habits that we want to break, and we all have habits that we want to establish or get into a routine of doing. The quote, I have a quote that comes to mind when I think of this question, and it's by Jocko Willink, who is a Navy SEAL extraordinaire. And he said that unmitigated daily discipline in all things. So if you think about it, it's not just, if you look at it as a whole, it can be a little bit overwhelming. So you have to start small. You have to look at what you have control over in your practice. Look at your equipment, check your location of your instruments. You have to check your seating positions, or how are you positioning your patients. And so all those little things can add up to a very favorable or non-favorable ergonomic position. So hopefully, after hearing the lecture and taking in all the information that is put forth, that you'll take an inventory of what your particular situation is and then apply those principles. You have to take it step by step, patient by patient, procedure by procedure, and you really have to kind of reprogram your mind to reprogram your body. It's a process. It's not going to happen overnight. And it's just like, when we tell our patients, brush and floss daily, it's going to take some time to get that habit to become routine. And it's the same thing with these ergonomic principles. It's easy to get into let's just get it done quick, but sometimes, quick isn't always better. You have to think long-term for yourself. Your patients are only with you for small segments of time, but when you're seeing patients all day, it can actually have a cumulative effect that can be detrimental outside the walls of your practice.
All right. Good advice. Establishing good habits. It's going to take time, and patience is necessary, I suppose.
Yeah, yeah, unmitigated daily discipline in all things.
Mitigated daily discipline in all things. Good advice for all parts of life.
Indeed, indeed.
Question number two. There are times when perfect ergonomics are just not possible. Some patients in clinical situations just require a lot more ergonomic compromise, I suppose you would say, than others. I think of our pediatric colleagues. Any suggestions for handling these appointments when ideal posture and ergonomics are just not realistic?
Yeah. I think of a contortionist sometimes when I think of some of the positions that we put ourselves in. And let's be honest, there is no way to avoid these positions that we put ourselves in. We have patients who can't lay back completely, wiggly pediatric patients, patients who can't open wide, or a challenging tooth to get in. So there has to be a give somewhere. And unfortunately, we are the ones who have to make that sacrifice because we're the one in the driver's seat. We have to do what we need to do to get the job done. And so there's two things that come to mind when we think of these things. One is if you're put into a position that is outside an ideal position, which there are many instances that there are, it's to take small breaks in what you're doing. You want to decrease inflammation. And so if you're holding a static position for an extended period of time that is not healthy, then inflammation is going to set in, and then all the sequence of events for MSDs will eventually happen. So if you take breaks to break that cycle, pull away for 10, 15 seconds, and your patient's going to appreciate it too. Those little things will help during that appointment. So if you have a challenging patient that's coming, have your treatment coordinator give you a little bit of extra time. Try to do things as ergonomically, ideally as possible. Positioning the patient, your assistant, those types of things. But micro breaks are huge. The other thing that comes to mind is when we're put in those positions, if you don't have a good strength in general, with regards to your muscles and your tone and your ability to hold those awkward positions, the progress of detriment can be a lot faster than it would otherwise be. So do exercises that strengthen your core, your accessory muscles, the stability of the ligaments that hold the skeletal system in place. And so there are things that you can do that will assist you in those awkward positions that will ensure that you come out of those appointments less fatigued, less sore, and again, be more favorable in the long run. So strength is huge. You have to kind of go back to the basics, common sense type stuff.
I'm glad you brought out MSDs because musculoskeletal disorders are very much a focal point of your article. And it kind of leads into the next question. It can be really difficult to be honest with yourself when you're having a problem. What are some of the first signs that a dentist may begin to show an MSD, and it may be time to make changes or get help?
Yeah, I think it's human nature to admit that something may be wrong. It's with that thought in mind, and that it's the exact reason that you actually have to recognize the fact that something's wrong so you can address it so it doesn't become a bigger problem. Going back to the patients, you tell them that they have a cavity, it's not going to be that big of a deal if they address it sooner than later. And so we kind of have to practice what we preach in a way. Recognizing these signs and symptoms, and some of them are subtle. Some of them will ping pong back and forth between I feel good, I feel kind of yucky, what can I do to change it? Toughening it out does not make it go away. It just makes us more resilient. The body does amazing things when it's put into certain positions and it's put through strenuous scenarios. It will modify and adapt itself. You may not recognize that that's the case. And so you have to take that head on. Don't wait to be sore. Don't wait to be in pain. Don't wait to feel fatigued. Don't wait to think, oh, I'm really not feeling all that great. I'm going to need a little bit more time for this type of procedure, or, those types of things, because it snowballs. I think we all like to consider ourselves forever life 20-year-olds, but we're not. But we have to recognize what our body's capable of, and we have to respect it for the type of machine that it is. And so if we treat it with respect, and if we recognize these things that it's telling us, I think in the long run, it'll make us stronger, it'll make us better, and it'll make us more cognizant of what we're really capable of. You know, we may wear a superhuman hat in a lot of areas of our life, but you know, it's earned. And, you know, I think that earning comes more with the recognition of our abilities. And so use the resources that you have at hand. Go see a massage therapist if you're starting to get sore. See your chiropractor, because they are a tremendous resource for good alignment. And I have a standing appointment with my massage therapist, usually 1 to 2 weeks, and it's like the best hour ever. I don't know why it's so hard for us to treat ourselves to things that feel good and that are good for us. And so it's a great way to put us in that direction of recognition, and then realizing it's not bad, but not treating it is what can be detrimental down the road.
All right. I appreciate that. Good advice. Well, those are my 3 questions. Dr. Gividen.
The real quick, it's Gividen.
Gividen. I have been
That's okay.
mispronouncing your name for all this time.
That's okay. It's common. It's French. The G sounds like a J. So if we were in France, it'd be Gividen. So, but
well, Dr. Gividen, thank you very much. It's good to finally make that correction.
Likewise.
So thank you so much. I appreciate it. For those who haven't read the article, I recommend you pick it up. If you have, and this goes for your entire dental team. There's a lot of knowledge that can be shared with everybody on the team, not just the dentist. So if you're thinking about taking your team to see Dr. Gividen in Bedford, please do. I encourage you to do so. You can always contact me and figure out how to get there. Any closing thoughts?
You know, this is one of those things that, again, like you said, there are take-home points for everybody. You know, the dentist for sure, obviously, because I'm a dentist, but there's a lot of information that can be applied not only in the practice, but outside the practice. And really that's the main goal, is to live, not just exist. You know, work is always going to be there, but we don't want to miss out on opportunities in life, because what we do at work puts us in a situation where we're not able to live to our fullest. And that's really a key point to remember.
Fantastic advice. There's so much out there. You certainly don't want your body betraying you in order to get out there to see it.
No, we don't.
Yeah. All right. Fantastic advice. Thank you so much. I appreciate you joining us.
Of course. Thank you.
Looking forward to seeing you in Bedford. Take care.
All right. Okay. Looking forward to it. All the best.